Greg, thanks for coming in today. I just wanted to talk about the mouth guard. There's a lot of people think that these things reduce concussion, but that's not entirely true, is it?
No, Bernie, it's not entirely true. Mouth guards are the one proven way to reduce the risk of dental injuries.
Right.
You only get one set of adult teeth, so it's really important to look after them.
Okay.
Mouth guards will also help reduce risk of injuries to your mouth and your lips and your tongue.
Right.
And they may also reduce the risk of fracturing your jaw, which is also really important.
Well, that's a good reason to wear them.
Absolutely.
Yeah. Well, Greg, that's the mouth guard sorted, but talking about concussion, what are some of the things we've got to look out for in the game?
Yeah, well, so if someone has a potential concussion, there's a range of things that they may display or you may notice. Sometimes they can be confused or appear dazed. They may be discoordinated or have poor balance.
Right.
They may even answer things slowly or maybe get the calls wrong, or sometimes they even run in the wrong direction.
Oh, I've seen that.
Yeah. They may even tell you that they're not feeling quite right. They may complain of a headache.
Right.
They may feel nauseous or like they want to vomit. They may have blurry vision or double vision. Or they just might feel really, really tired or maybe even confused, not sure where they are.
So that'd be good things for the coach or anyone on the sideline who notices that. That's a trigger point to think something's not right.
Absolutely. Any one of us can pick up a concussion. It's not just the coaches or the people on the field. Yeah, absolutely.
Good. So Greg, the game's over and everyone's done their job well on the field and people go home. I've heard of things like concussion presenting later on after the game. What are some of the things that might turn up at home that you weren't expecting that should look out for and be quite suspicious about?
It's really important in the first 24 hours, if you notice anything that's unusual, to seek medical attention.
Right.
Things to watch out for are if a person develops a headache, and particularly if it gets worse.
Yeah.
If they become progressively more confused, they're not sure where they are, they can't recognise people or places. If their coordination seems a bit awful, they become unbalanced. If they become nauseous, or particularly if they vomit,
right.
That's really
that's
important.
Quite a signal.
Yeah, and if they become drowsy or they can't be woken up, or if they pass out and have a seizure, that's really, really important. Make sure you get to seek medical attention really quickly for that.
So look, 6 o'clock in the afternoon is a pretty unusual time for a good fit young bloke to want to go to bed and lie down and retire. That's a sign.
Yeah, and if someone has had you think they have had a concussion, it's really important in that first 4 hours that you don't let them go to sleep.
Oh, really?
Yeah, because you got to make sure you be able to pick up those signs and symptoms in that first 4 hours, because that's the biggest risk time for things to happen.
That's great. That'll be really useful for people to watch out for. Thanks for that.
Yeah.